webinar educational opportunity for those of you who are having small businesses. I'm Dr. Michael Caldwell, the Director of Public Health. I'd like to thank Mayor Cooper, as well as Mary Falls and the Office of the Mayor, as well as you and our participants in joining us today to learn how we can share best practices, ideas, and think of ways that we can reopen Nashville successfully. And this is now our opportunity to prepare to reopen Nashville successfully. And in order to do that, it takes everyone. Even just one business that is not doing things well, it could harm us. Today, I issued Director of Public Health Order 4, which requires signage to be put at every facility where the public is invited. That would be restaurants or any public facility. Now, the requirement is the signage, and it says something to the effect of, please help us to follow CDC guidelines and make sure that you wear a facial covering or mask when entering our place of business to protect our employees and to protect everyone else. Now that's important because we want to create an atmosphere of safety and health. We also said in there that I ask you to require that you should require that your employees wear face masks or facial coverings and people who visit your facility. That's not an absolute mandate, but it is a request that you should be doing that. We will help you to try to do that the best way that we can. So remember, we still are under the Safer at Home order, especially for, well, everyone, but especially people over the age of 65, people with chronic medical conditions. Even after we will go into phase 1, we're still going to recommend that those people limit as much as possible being outside. Please go ahead right now and start asking your questions now for the small businesses. In the Q&A feature in our chat box, we'll be reviewing those questions as you submit them and answer them in real time as best as we can. And then for our Q&A session, we'll choose some of those that seem to apply to many of your small businesses. So when you do submit a question, please know it's in the queue and try to avoid submitting it multiple times, because that would just delay us in getting the answer back to you. So this is an opportunity for us to share. Our initial goals are education, communication, beginning a conversation to learn about best practices. We're going to ask you to reimagine your business, your space, your employees, and customers in a new COVID world. Focus first on the health and safety of your employees, because that will set the foundation for what you can do when you invite in your customers. We want you to be visible in what you do. Be a leader. Be creative. Be reassuring. And be reassuring is not just saying, hey, we're doing fine. It's the visible sense of people wearing masks, maybe a sign of the kinds of things that you do to keep the place clean, the fact that you're testing your employees' temperatures and making sure no one in the place is sick. Give a sort of a list of guidelines and promises to your employees and your customers. Be transparent in that regard. And please, as we are today, be willing to share and help all of us learn from best practices. We'll be eventually announcing a technical advisory support team on reopening. It's going to be led by Mr. Tom Sharp in the Office of the Department of Health. Now, while that's in development, we're going to ask you to very carefully look at when the order does come for reopening. Look at that carefully and see if all your questions could be answered through that. And we're going to have a lot of frequently asked questions, and that's what today is about, to start trying to figure out what are your questions, how can we help prepare together. So our agenda is the following. We're going to have some comments by Dr. Alex Jahangir. He is the chair of the Board of Health and also the chair of the Coronavirus Task Force. He'll be going over the nuts and bolts of operating in the age of coronavirus. Next is our Director of Environmental Health Sciences, Mr. Hugh Atkins, who will be talking to you in some detail about how can you make your workplace safe. And we've already gotten some questions in advance, and we'll go over as many of those as we can. We're lucky also to be joined by Martha Boyd from Baker Donaldson. She'll discuss her advice on how to keep employees safe in your businesses. And then finally, we're really lucky and grateful to have some peer-to-peer colleagues, Mark Faulkner from Vario Systems, thank you for being here, and Manuel Delgado from Delgado Guitars will be sharing their perspectives with us. So right now it's my pleasure to ask Dr. Jahangir to come and start this webinar. Dr. Jahangir?
Thank you, Dr. Caldwell, and thank all of you for what you are doing for our community and for your patience and partnership as we get our society and our community back opened and get back to our new normal. I kind of want to just speak briefly about where we are as a city in our before we roll into phase one of our reopening plan. As you may have seen this morning, Mayor Cooper announced a delay in reopening phase one, an extension of our safer at home order decision till at least next week. And the reason for that is the following. From day one, Mayor Cooper is committed to using the science and the data to drive the decision on his fairly to date. And so the science and data that we've been looking for are something called the transmission rate. So how often does one transmit? If somebody's infected, how many other people you infect? We've been looking at the 14-day trend in new cases, the public health capacity, our testing capacity, and our hospital capacity. And what I want to tell you right now is hospital capacity is amazing. So the ability to be seen and taken care of in our hospitals, really good. Our public health capacity. So when we started this whole corona business, we had 4 individuals who would make phone calls for what we call contact tracing. So if you got sick, they would call you and figure out who you've spoken with and call them and so forth. In just 6 weeks, under Dr. Caldwell's leadership, that group has grown from 4 to 82, which is really on par with the best marks around the country. So public health capacity is really good. Testing capacity has gotten really good. We just last week we tested 5,000 people in our city, which has been shown to be a really good benchmark for a city our size. The way we're doing that is we have some great health systems in town, but furthermore we have our community assessment centers, which we started about a month ago. Currently they're operating Monday, Wednesday, and Friday, and now as of next year we're going to go to 5 days a week. These are free. Anyone can drive up. There's, thank goodness, been minimal wait. And the reason we expanded to 5 days a week is as businesses are opening up and you have employees who come to you who may have symptoms and you want to show them where to go, you can now refer them to our community assessment centers and they can get this care that they need, that the community is supporting, and that the Mayor Cooper supported from the get-go. So those things have been good. Now the question is, why do we not announce reopening today? Because the one part of this whole thing that is not heading the right way is our trends, or how many cases we have. If you look at a graph of our cases, when we first started this on March 8th, we were doing this, and then the safer at home order was placed, and then you saw a gradual downslope, which is superb, which you expect. Now, unfortunately, we're starting to see an upslope again, and what we've said is we want to have a stable number or a decrease. That average for the past several weeks has been around 80. So if over the next week our average ends up being around 80 cases, and I say around because there are certain exceptions. If all of a sudden we know there's a cluster in a nursing home that we controlled and they didn't spread out, then we probably will accommodate for that. But if the average is 80, then I think Mayor Cooper will announce a reopening date as early as next week. So that's a long spiel, but I think I want you guys to understand what we're looking at to reopen. Because at the end of the day, what public health experts and health policy experts have shown, that if you do just a small investment of extending a stay-at-home order for, let's say, a week longer, 2 weeks longer, to allow some of this curve to flatten, the long-term probability of having to close goes down exponentially. So a little pain now hopefully will lead to long-term success and long-term reopening for a long time. And that's where Mayor Cooper's head is on this, and I greatly support that, and again, driven by the science and the data. So with that said, some of the questions that I want to just hit right now is, why 14 days? Why is it the magic number? And the short answer is that's the life of this virus. If you get infected with this virus, within 14 days you will have recovered or you'll have died. And so 14 days is not some just random number we pulled. It's why we've chosen 14 and why that's an important number. One thing that we're asking is, should that business owners, when we do reopen businesses, is take the temperature of your employees, and also do screening questions such as, do you have a cough? Do you have shortness of breath? Do you have loss of smell? Those are signs of COVID. And the reason we're asking you to do this is, if you have an employee that has any of those symptoms, send them to a community assessment site. What you don't want to do is expose the rest of your workforce, because a prolonged exposure to your workforce will then get all of them sick, and that will hurt your business. What we're not doing, that the governor has done, but we believe this is probably a little too much of a burden, is to ask you to screen all your patrons. Now, if you choose to do that, your prerogative. But for your patrons, we're going to ask that you post a sign that says essentially what things. You have a fever, chills, shortness of breath. And if you do, please don't enter our store. This is going to be our new normal until there's a vaccine. So that may be a year or more. And what I hope is that our society respects each other enough to take care of that. And that will allow us to have that long-term opening of our businesses. And that's really the thing, is as long as we get our vaccine, until we get a vaccine, then this will always be something to be of concern. And then finally, really quickly, I want to talk about, should you wear a face mask in public? Dr. Caldwell today issued an order that recommends wearing a face mask in public, and mandates the posting of a sign that recommends that to all businesses. And the face masks made out of cloth is essentially to protect both the person who you're speaking with or interacting with, as well as them from you, and vice versa. And really, these recommendations are for anyone over the age of 2. Obviously, if there's special needs that would preclude you from doing that, then there's reasons not to do that. But it is a good thing, just as much as wearing a seatbelt is good now, and putting your kids in child seats for the next so much time frame. Face mask wearing is going to be important in public. And so we are asking that. And then the final thing I want to touch upon is I want you to recognize that, I appreciate you encouraging your staff that can work from home to work from home. I know there are some parts of your business that's not feasible, and that's completely understandable. We want to get you back into business. But if you can encourage them, that'd be really great. Also, encourage employers to reach out to employees regarding their employees' safety concerns. You may have some employees that are worried to ask you certain things. Maybe they have a health condition you're not aware of. Making an environment in which they feel comfortable speaking to you about that, and then if there's a way to accommodate their needs, that'd be grateful. But again, that really begins with you. You guys are the heartbeat of this city. The city is. I grew up in this city. I've raised my own family here. Very involved in the community here, and without you guys, this would not be possible. So thank you for taking the time to listen to me and to be part of this, and we look forward to partnering together as we get our city open. And now I'd like to introduce Mr. Hugh Atkins, who's the Director of Environmental Health for our Public Health Department. Thank you so much.
Good afternoon, and I appreciate the opportunity to be here to talk a little bit about the reopening of retail and businesses in phase 1. I, in my role as the director of the Bureau of Environmental Health Services of the Metro Public Health Department, we regulate a lot of businesses, but not all of the ones that that are reopening, of course, do we have regulatory authority over. So we are going to work with these types of businesses to see what the best practices should be to open up, and we'll touch on some of those here today. I'll say again, I appreciate all the businesses that have closed and reduced their operations to help flatten the curve. I know that's been tough on all the businesses, but it's made a difference, and we want to reopen responsibly so we don't make some mistakes and have to revert to an earlier phase or anything like that. So I appreciate everybody's cooperation, and I appreciate the sacrifice that the business owners have made. I'm going to talk sort of organize things in retail practices for the operators, and also things to protect the customers, but they all are interrelated in that if you're protecting your employees, you're also protecting the customers, and likewise, if you're a customer, you need to do certain things to protect these frontline workers that are there for us during these difficult times. Again, as Dr. Jahangir just mentioned, any employees that can work from home, we still encourage you to do that as much as possible. And you'll want to screen those employees that do come in for symptoms of COVID-19 when they report to work every day. And you can do that in a couple of ways. You can take a temperature screening. Best practice is for employers to do that with the no-touch thermometer, and we're looking for a temperature of 100.4 below 100.4 degrees. Then there are questions you can ask your employees about exposure to COVID-19. Have they been exposed to somebody that they know has had a confirmed case? And then are they symptomatic? Have they been experiencing cough, shortness of breath, sore throat? Have they had a fever within the last 48 hours? Have they developed new loss of taste or smell? And have they had vomited or diarrhea in the last 24 hours? So those are the first things you do to screen your employees as they come into every shift. They should be wearing face coverings, as we've mentioned. You don't want to be wearing the N95 medical mask. Those should be saved for health care workers and other personal items as recommended by the CDC. It would be good to have hand sanitizing stations and wash basins with soap and hot and cold water, bottle of hand sanitizer readily available, and encourage employees to utilize that. Of course, we're wanting social distancing among employees. They need to maintain 6 feet apart and make sure they keep an eye out for that and do that as practically as they can. It would be good to post information about health precautions for the patrons and the employees, the staff. Again, you want to maintain social distancing in all aspects of your operation. The employees working within the store or business, you want to make sure you're practicing social distancing in the checkout lines, in the break rooms, anywhere that there may be multiple people. Things that help out are automatic doors to reduce touching, reduce the amount of people using elevators, and provide, again, hand sanitizers by doors and around elevators as well. The break rooms and common areas can get to be an issue. You might want to remove tables and chairs from there and spread them out to make sure to discourage congregating in those areas, and keep them 6 feet apart, and post signs there to remind people. And some places we've been in, we see them marking spots on benches and we've even seen people put barriers to setting on certain parts of benches. So those types of things can maintain social distancing. Another thing you might consider is, and you probably do some of this anyway, stagger your shifts where possible, stagger your breaks, stagger your meal times, so you don't have people congregating during those periods. Increase the employee hygiene practices. wash hands more frequently and encourage that. You want to, as Dr. Hildreth says every day on the updates, avoid touching your face. Practice good respiratory etiquette. Cough into your elbow, sneeze into your elbow. Wash your hands frequently. I'll throw that in again. Again, very important for employees to stay home if they're feeling ill, and then report any symptoms they might have and of COVID-19. And certainly if they answer yes to any of the screening questions, then that is something you need to deal with. And anybody that is running a fever or answers yes to any of your screening questions, whatever you're doing there, needs to leave the premises immediately, seek medical help, and get COVID-19 testing, and then check in with the health department for those guidelines. And the employees should remain away from work until they get their test results back. And employers need to be careful that they maintain the confidentiality of the employee health information. If you have employee illness policies, it would be good to update those, include COVID-19 in those policies, and have the staff read over them and sign those so they will be aware of all the issues surrounding COVID-19 in the workplace. As Dr. Caldwell mentioned, you need to post a sign. That's Order 4. Specifically, the sign should say, "Dear customers and visitors, please help us follow CDC guidelines by wearing a cloth facial covering or mask while in our business facility, and this will help protect our employees and each other." And that's at all public entrances to your facility. When we move on to talking a little bit about how to protect the customers and consumers, of course, we're requiring you actually to limit the number of customers inside the store at a given time, and you need to keep it at 50% or less of the store occupancy capacity based on the Tennessee Building and Fire Code. So that's the first thing, reduce the amount of people that are in there. You can do this in several ways. You need to keep an eye on it, and maybe even have somebody stationed at the entrances to make sure they're keeping account of how many are in. If you reach that limit, tell people they can't enter till the same number leave. You could encourage people to, one per family maybe, to shop in the store at a time instead of the whole family of 4 being in there, and not only risking social distancing with other parties that might be in there, but taking up part of that capacity that other customers could be using. It would be good to consider dedicated shopping hours or appointment times for the elderly or medically vulnerable and healthcare workers that need to get in and out. Of course, we're encouraging those 65 and older or with underlying health conditions to remain safe at home in the first place, but they have to get out and buy groceries and buy necessities. So if we could have dedicated hours for them, that would be good. One thing that I'm seeing and is a good thing to do is establish one-way aisles and traffic patterns. That helps maintain social distancing. During the Safe at Home order, many businesses went to curbside service, pickup, and delivery service, and those options will minimize contact and help maintain social distancing and keep people out of stores maybe. So that's a good way if you establish those practices during the lead up to the reopening. Those are good things to keep doing. Assign dedicated staff to prompt customers regarding the importance of social distancing, and just remind them. I think it's hard to change some habits of congregating, but if you have people around and signs and posters and things of that nature to remind people, I think they will do a better job of it. And stickers on floors and marks in the checkout aisle have seemed to be working well in the essential businesses that have been operating all this time. Some other things to mitigate exposure in the workplace: you can modify scheduling, like I said, implement workplace cleaning and disinfection practices, follow the CDC guidelines, and do regular sanitizing of high-touch surfaces at least every 2 hours. Keep an eye on the shared resources, like shopping carts after each use need to be sanitized. Sanitize all high-traffic, high-touch areas like counters, checkout lanes, keypads, break rooms, dressing rooms, restrooms every 2 hours and when they're visibly dirty. Use clearly designated entrances and separate clearly designated exits to maintain social distancing. Plastic shields or barriers between customers and clerks at service counters. Clean them frequently. 2 hours, don't go over 2 hours without cleaning them when visibly dirty. You can adjust, a lot of people have already done some of these things, adjusting store hours to allow more time for cleaning. Prohibit the use of reusable bags. I saw this. This is a recommendation. It's something that, may be a little counterintuitive. Right now, a lot of us have gotten to where we use the reusable bags, but, reusable cloth bags could transmit, may carry COVID-19 if you set it on a surface and take it out. Limit self-service options. Suspend sampling of food and personal hygiene products that you see in the aisles of stores. And task the management level employees to monitor compliance within the store. And that'll go a long way. I think if we gently remind people of social distancing, we can get some compliance on that. And we've been doing these things in the essential businesses so far, so this is just to translate into the places that are being allowed to open in phase one. We have a reminder from Metro Water Services, an advisory that buildings that have been unoccupied or used less frequently, the interior water quality can deteriorate. So stagnant or standing water can lead to low or undetectable levels of disinfectant like chlorine, and then they cause conditions that increase the risk of growth and spread of diseases like Legionella and other biofilm-associated bacteria. So make sure if you've got a private water system, and keep in mind your private water system starts on your side of your water meter. So from there to throughout your facility. So you need to flush the water through all your fixtures in the facility, every bathroom fixture, sink, whatever, in the break room, flush those out. There are guidelines for that at Metro Water Services webpage, and also on the CDC website has guidance for larger buildings and larger water systems. We, as we mentioned, we'll be doing some question and answer. Some of those are probably already coming in, and we'll try to answer as many of those in real time as we can, but we will try to get to those. Some of them that sort of came in before, leading up to these webinars. I'll talk about a few of those. Best practices for ingress and egress. I talked a little bit about that. You need to follow your fire marshal guidance. Don't close off more exits than the fire marshal allows, but keep it at a minimum, but make sure you're following the fire marshal guidance. Another thing we've had questions about is establishments or businesses with multiple rooms and keeping the crowds down to 10 or fewer. We still have restricted crowds to 10 or fewer in public places, but you are allowed as a business to operate at 50% of your capacity. So that capacity will be set again by the fire marshal. So whatever that capacity is, you're allowed to have half that many people in there in phase one. So the 10 per it really doesn't apply there, but even within your store, if you are, or business, and you're at 50% capacity, we want social distancing, so we don't have all 50% of your customers in one area of your store. We want them spread out sort of like a gas in there. So keep that in mind. Elevator usage is something else we get some questions on. It is a confined space. They should be thoroughly disinfected throughout the day. Think about the keypads. Make sure you sanitize those. Only keep 2 or 3 people per elevator trip, depending on the size of that elevator. Some of these big construction elevators can have more than that, but they still need to be spread out at least 6 feet. Use a pen or a cloth or some other device to press the buttons of the elevator. Keeps the risk of contamination down. We also have been asked if the health department's going to be monitoring social distancing. The health department regulates, like I said, several types of businesses. Just running them off the top of my head, I know we do restaurants and public swimming pools, hotels, motels, tattoo parlors, some of these opening in different phases. And we will be conducting routine regulatory inspections in those and looking for these types of things when we're in there. But we're not going to be on a patrol looking for these things. And we are, as the mayor has pointed out on several occasions, Dr. Hildreth has, and lots of people, we expect people to do the right thing. We do. We know what we're supposed to do as just citizens. So the businesses are going to do their part. We as just private individuals need to do our part too and work on the social distancing. We have gotten questions about malls. Malls are a complicated thing. When you start thinking about reopening, they are a retail business allowed to open during phase 1. If you run a mall, you have a maximum capacity that is set by the fire marshal's office, and that's through you can get information at the Tennessee Department of Commerce and Insurance website. So the mall capacity is one thing, but then each individual store has their own capacity, and the capacity of the store, according to the fire marshal, does not count toward the capacity of the mall itself. But the mall then has, through the fire marshal's office, a capacity for things like food courts, how to figure that. So if you manage a mall, you should have access to that. That is a capacity that's in there. Same way with businesses that may open in later stages, like movie theaters and sports venues. There are maximum capacities set by the fire marshal's office. And right now in phase 1, the businesses that are allowed to open are at 50% of that. And, we're talking about the phases there that we've gotten a lot of questions, and we expect to continue to get those questions about why isn't my business one of the ones that's in phase 1? Why am I having to wait to phase 2 or phase 3? There are reasons for that depending on the operation of those types of businesses. Things like gyms and hair salons where there is equipment or the nature of the business is more one-on-one, and it's difficult to social distance maybe, or difficult to ensure that equipment is sanitized as often as it needs to be. So we're easing into this in phase 1 with certain businesses that are not as problematic. As we do this, we can evaluate where we are. Hopefully, we're not going to see a return to more going less openings and going backwards in the phases. But if we see evidence or things along the way, we certainly can entertain the possibility of maybe moving things from phase 3 to 2 or 4 to 3 or whatever. But right now we're set in these that are at phase 1, and that's what we're talking about today are businesses that are opening in phase 1. But we welcome your questions, and we'll try to get to them, but we're going to focus today on issues associated with businesses that open in phase 1. And I'll be around for those questions and do our best to answer those. And right now, I'm going to turn it over to Martha Boyd, an attorney with the firm of Baker Donaldson, to talk about keeping your employees safe. Thank you.
Well, thank you, Dr. Atkins, and good afternoon, everybody. So businesses operating in this environment have two significant challenges with regard to your employees, and that is keeping them safe and then reassuring them that you're doing what is necessary to keep them safe. And the key to achieving these goals is to first have written protocols that incorporate best practices and guidance from the CDC, OSHA, and local government, to communicate these protocols to your employees and train them, and finally to follow and enforce these protocols, because it will do you no good at all to have written protocol that is put away in a drawer that no one follows. So what I'm going to propose to you today is a little bit of homework for you, but fortunately, since the reopening is slightly delayed, you've got time. And what I want you to start working on is a few documents that will help you once the reopening comes to reopen safely. And that first document I'm going to suggest is a reopening protocol. It's basically the document that describes how you're going to operate during the pandemic. And it includes things like employees have to wear masks, how you're going to arrange your desks or workstations, guidelines for use of the break room. You want to think about whether you're going to require employees to remain on your premises for meals or allow them to go out. Basically, it's going to be your roadmap to opening and cover everything your employees will encounter in this new normal day that they're going to experience when they return to work. Dr. Atkins talked about changes to entrances and exits and cleaning schedules and elevator protocols. All those things should be in this document. This document should not be created in a vacuum. It shouldn't be created by the business owner yourself. It should be created with other managers and with your hourly representatives in the planning process, so that you can get different perspectives on what needs to happen from day to day. I would say this is going to be a dynamic document. It's not going to be static. We're going to get different guidance over time. Things are going to change, as they already have, rapidly. So I would say be prepared to update this frequently depending on what works for you and what doesn't work, and save every version as a new version. So you have a date, you know what date you made certain changes to the protocols. So if there's any questions asked later on, you could say, on June the 30th, we changed the protocol in a particular way. This is what we added. So whatever your protocol ends up being, you've got to lead from the front on this. If your employees see you walking around with a mask on your head or around your neck because you don't want to have it on your face, they're going to believe that you don't take these safety protocols seriously, and they're not going to do so either. Dr. Atkins mentioned daily screening. We recommend daily screening of your employees, but I would also suggest that in addition to that, before your employees return, you prepare a document that has a list of all the COVID symptoms, and we know the big three: fever, shortness of breath, and cough. The CDC added 6 new symptoms over the weekend. I would list all those symptoms and tell employees if they experience any symptoms such as the ones listed, if they're, they need to let their supervisor know immediately. If they are at work, they'll be told to leave. If they're not at work, they'll be told not to come in. And that their failure to notify you immediately may result in disciplinary action. And that sounds harsh, but the consequences of someone failing to report when they have symptoms and just coming to work anyway are pretty grave. I mean, they could give the disease to a coworker who could have a really, really negative outcome. Hopefully you won't ever have to use that disciplinary process, but I think it's important to make it very clear to employees that you take this very seriously. So I would also suggest you have a protocol for what to do when an employee gets sick. We know you should call the health department, and that's fine, but you also will want to sort of have a guide for your managers that walks them through what to do from time to time when you have a sick employee, and provides them with the time that they should wait before the employee can come back, and what to do if the employee is tested, and what to do if the employee simply has symptoms but is not tested. I would also suggest that you get familiar with the new Families First Coronavirus Response Act. That was the law that was passed last month by Congress as a way to give paid leave to employees who are experiencing problems resulting from COVID. There's one component of the act that gives employees paid leave if they have a school or daycare center that has been closed as a result of COVID, and we're going into the summer now, so the same would apply to the summer daycare or camp or whatever they normally rely on. And another component of this act provides paid leave to employees who actually get sick or who are quarantined or who are taking care of someone who's quarantined. Normally the Department of Labor provides us forms to have our employees complete when they are requesting leave, such as under the FMLA. They have not provided us any forms in this case, so I would suggest you make your own. We've created them for many clients, and what they say is, here's the request for leave, here's the documentation you need to provide, and that kind of thing. Two other things I think you need to think about are what to do about employees who have underlying health conditions or other risk factors that make them particularly vulnerable to COVID. These are, employees over 65, employees with, diabetes or other things. There have been a lot of well-meaning employers who have wanted to keep those employees out of work. Hey, we're not going to ask them to come back. I would suggest that doing that may subject you to a claim of discrimination. So I would instead say to your employees, hey, we're planning to call you back. If anybody feels like you need an accommodation, you're welcome to let us know. And handle those just like you would handle any other request for accommodation under the Americans with Disabilities Act. And not just, sort of across the board say, well, you're over 65, so you can't come back to work. And finally, I think you should consider what you're going to do with employees who don't fall into one of those categories. They don't have any underlying condition. They're just scared to return to work. And you will definitely have employees who fall into that category. And I think you need to consider what to do about those. They may not be entitled to any particular legally protected leave of absence, but a lot of business owners are trying to decide, hey, the compassionate thing to do would be to just allow this employee to remain out of work until they're comfortable coming back. So those are just some things I think business owners should consider as they contemplate the return. And I'll now turn it over to Mark Faulkner.
Thanks, Martha. First of all, good afternoon, everyone. I'm grateful there's so many people helping us navigate a careful reopening of our city. The small business owners and patrons of retail shops and restaurants and bars are all assessing what the new business normal might look like. But for those of us whose businesses the mayor and the Metro Health Department deemed essential, we were thrown into a new normal over a month ago, and we've already had to navigate and balance health and safety with productivity. And our company, Vireo, which Vireo is a Latin word for health, was designated an essential medical support business since one of our plants manufactures hand sanitizer, and we also make sanitizing laundry detergent, sanitary wipes, bacterial sprays, and such. But our plants don't interact much with the public. So what I'm going to briefly share are just some of the practical things that we've done and that you business owners might consider doing as you focus on optimizing a safe workplace. Because none of us certainly want to have a relapse into the health and economic crisis that we've been in. So when the shelter-in-place mandates were released, we started needing to protect our team members right away, and yet still get work done. And we've been successful in maintaining the health of our team and still conducting a high volume of business. But it's something that we continue to be focused on because we small businesses really have to keep our employees healthy because we oftentimes don't have enough bench depth to have people out sick. So we immediately deployed as many people to work at home as possible, which was really most all of the administrative, marketing, sales, and finance teams. And those folks will continue to work remotely even through these early phases of reopening. We are all fortunate that technology has made working remote much more effective than I would have previously imagined. But since our production and our warehouse people cannot work at home and have to be on site, we have certainly monitored their health and followed CDC recommendations and leveraged PPE and workplace distancing. And in that, we have stayed safe and healthy, and we've kept production going. And we'll really only bring back the other team members as situations continue to improve in the city. Even with many of us working remotely, or many of the team members, we've tried to keep our team feeling connected by having daily morning video huddles with everybody, which have really turned out to be fun and productive. And we're prepared for quick emergency communication by having set up an email and text strings that include everyone, because I think as both Martha indicated and Dr. Atkins, that communication with your team is extremely important. As Dr. Atkins indicated, we and other essential businesses have also assessed the workday options, like as he said, staggering some of the team members' hours so that fewer people are on site at the same time. And of course, the basics of keeping hand sanitizer in every room and directing people both verbally and with signage who might be touching doors or things to sanitize before they engage the surfaces. And my mom would be very proud that we have ramped up our Southern manners, and we hold doors open for anybody coming or going so that we limit the number of people touching surfaces, still sanitizing afterwards. But we've also, as another suggestion that Dr. Atkins had, we've removed some of the chairs from the conference room and break room so that only so many people can sit and congregate at a time. And the use of paper plates and disposable cups and such things helps to preclude the washing and the sharing of utensils and dishes and glasses. And besides conducting the video meetings with remote team members, you can also do so among your people at work. A video conference with each person in their own office allows you to still be face-to-face, but without needing to be in the same room. I've even smiled to hear fellow team members encourage and overtly speak out reminders to others of, hey, have you washed your hands recently? It's good to know that we're all in this together. Obviously, use PPE when other people are around, because even just little things like a Tennessee spring allergy or asthma could end up becoming an underlying condition, since an overlay of any respiratory illness would be compounded. And we are basically in a circumstance of having no visitors at our location. We maintain the main buildings locked so that there's control of who comes and goes in our place of business. This may not be an option for many businesses, I understand, but it's a good idea to even at least have someone working near the door to control the opening and to screen people coming in, and thereby limit the number of people inside at any one time. And besides, as previously indicated by Dr. Atkins, yes, more regular cleaning and wipe down of surfaces. You can also do some simple things like using time to do disinfecting for you. This involves just some easy changes of habits, like when the mail comes, you don't have to collect it and distribute it right away. Let it sit for a couple hours, since the virus typically doesn't live on paper very long. And of course, still precautionary hand washing and sanitizing after. But you can also have delivery guys drop deliveries in designated, protected, sometimes even outside secure areas, and thus prevent the need for the delivery guys to come inside. You can set up exterior bins for depositing bill of ladings or shipping documents. And if you plan ahead a bit and order ahead, hopefully the contents of the packages wouldn't be needed immediately, and then you can just leave them in place. You can effectively quarantine the boxes for 24 hours or so, since that also is about the time limit that a virus can live on the cardboard. So as you look to reopen, make sure, as indicated earlier, talk to your entire team. Walk them through all that you're doing and give them an opportunity to ask questions, because some of them will definitely have trepidations about coming back to work. And some of them may have great suggestions for safety that are specific to your place of business. The mayor's office and the Nashville Chamber of Commerce have good websites with great info for us. And the Tennessee Chamber website has links to a library of best practices to help guide employers. The bottom line is, though, even though we all want to reopen, do not reopen if you can't confidently answer yes to the following three questions. Number one is, with increased workplace hygiene, are you able to reduce the risk of virus transmission? Number two, can you limit effectively team members' interactions and comply with or accomplish healthy distancing for those who need to be at work? And number three, do you have adequate protective measures and PPE in place for your team members? If you can answer yes to those three questions, then let's help get our great city back on its feet. Thanks. I'll turn it over now to Manuel, who has his own place of business and is looking to reopen.
Thank you very much, Mark. I appreciate it. I just want to take a minute and just acknowledge all of our small business owners out there. I want to tell you that I know sometimes as a small business owner, we can look and feel that we're in a unique situation. Maybe we're a very small business and we see other businesses and think that they have a lot of resources and things that are available to them that are not available to us. And I just want to tell you, as the third generation guitar maker of a family business that's been around for 92 years, I, of course, don't want to see my business struggling, but no sale is worth the safety or the health of the people we care about. And as much as I love what I do and I love my family's business, I just want to encourage everyone to try to do what's wise and what's smart for the safety of yourself, your staff, and of course your clients who are important as well, and ultimately to our fellow community, whether it be in Nashville or surrounding communities as well. We have no control over what other folks are going to be doing. I know some people are curious. Davidson County is following a different measure than other counties in the state itself. I personally think that the mayor's office is doing the right thing in the metrics that they're following, and I know it's frustrating. I know it's challenging when we see, again, as a small business, that we rely on those daily sales, but it's important to try to set up different practices that can help you be successful. So as Mark was saying, Mark deals more in like a wholesale environment where he's able to control at least what happens within his building, and now he's set up some very intelligent ways of how he's going to handle things that are being received. So he's already putting plans together for success, and he has been, because he's been doing this for some time, because he's been a necessary business, and that's the kind of example that we want to follow even as a retail business. Now we can start thinking about plans as well, what we can do as a retail business to be successful. One of the things that we've done, and I know it's going to be available on the Metro Nashville COVID website, but we've put up a piece of paper on our door where, very much in line with what Dr. Caldwell was saying, we're basically asking our clients for the safety of themselves and our staff that they wear a face covering. Now, we don't have excess of these, but we do have some face coverings, and if somebody doesn't have them, we'll actually hand them to them. I know some people, and we're in the same boat, have probably tried to see where they can buy some. I think even if you buy boxes of rags, you can find rags long enough to tie around. I mean, it sounds silly, but if you want to have somebody come into your business and they don't have anything available, you can make that offer to them. And again, at the end of the day, if the client chooses not to, you have the option of turning that business away, as much as we don't want to do that, because we value every client. But right now we have to think about the larger picture and the health and safety. And one person who could potentially be sick and pass that illness on could end up damaging a lot more weeks of your business rather than losing out on that one sale, as I mentioned before. So think about those kinds of things. We have rubbing alcohol that we ask our clients to use on their hands before they come in. Some businesses like ours, we don't have the ability to wipe down of our products. We make guitars. We have handmade musical instruments, and if you put rubbing alcohol on the finish, it ruins the instrument. So what we do is we're talking to our customers. If they're coming to drop off something, then we want to find out what it is, if it's a repair or so forth, and we're prepared for what they're doing. We have all the documentation necessary to help them. They drop off, they leave, we wipe the inside, outside of the doors, We ask them not to lean on counters, different things like that. We basically try to control the environment of where they're going to be in. If they want to come in and they're going to want to sample an instrument, then we want to prepare those instruments in advance. If you're a company that sells clothing or pottery or something like that, if you're able to find gloves or invest gloves or ask your client ahead of time to wear gloves, then you want to obviously cut down any of the areas that somebody might be tracking if they're coming and handling a lot of different things, unless you have the ability to just follow and wipe those things down afterwards. So again, putting some type of plan together. Look, we're all small business owners, okay? And we had to be entrepreneurs, and we had to be creative in order to create our business and in order to survive. And now is the same thing, okay? We have to start thinking about what the problem is going to be before the problem happens. So mimic what your customer might do when they're going to come into your store, what your employees might be doing. Think about what those issues could be and put a plan together on how we can solve those issues before they become a problem. With your employees, ask them to sign up for what the plan is as well. Again, if you go on the Nashville's COVID website, or we even have it on our Delgado Guitars Facebook page, we have a image of what we've promised to do for the clients, and I've asked my employees to sign that promise. So little things like this that you can do are a way to help just make sure that your public feels safe when they're coming into your business, and you feel safe to continue to do business, and your employees feel safe wanting to come there. And at the end of the day, if you're somebody who believes that what's happening right now is real, as I do, then you're going to take a very different approach. If you're someone who thinks that this is not the case, and you're going to be a lot more, I hate to say careless, but you're just going about things different, you think business is as usual, whatever, then we have to be prepared to cover all phases and all aspects of what might be happening. And the best thing we can do is if we could try to control that area. As Mark said, even with us, we are a retail business, but our door is locked. We have our phone number on the outside. If a customer wants to come in, we're asking them to call us first, and we will open the door. If they call ahead of time, we're going to ask to set up a time or have them contact us when they reach the business. We're limiting the amount of people that are in our space. And then just use common sense. Look at the space that you have. Just because you have 1,000 square feet, you're not going to squeeze 100 people in there. If you factor that they can all be 6 feet away from each other, you have to try to determine what makes the most sense, what's going to make your clients feel safe as well. So I'm going to stop now because I know some folks probably have questions, and I want to make sure that we have time to answer those if necessary. But I do want to thank the mayor's office for including me today, and I just want everyone to remain safe out there, and thanks to Mary as well.
Thanks, Manuel. And Mark also. First question is for Martha Boyd, our lawyer. Martha, if some employers have commissioned employees who work on commission, and the employees are not certain what the impact will be to them on unemployment benefits and so on if their hours are, or if their opportunities for commissions are so limited because business is slow. So any insight into the whole commission world?
Well, commissions do count as wages under the unemployment statute. So if you have your commissions are reduced and your hours are also reduced, you may qualify for unemployment. Tennessee has a kind of a quirky rule with regard to partial unemployment. So you can only get partial unemployment if your hours are reduced, and if you make less than the weekly benefit amount under state law, which is very, very low. So a lot of well-meaning employers have tried to say, well, we only have 50% of the work. We'd like to keep all our folks on the payroll, so we're going to spread out that 50% of the work to 100% of the employees and cut everybody's hours and cut everybody's pay. And the idea would be to hopefully keep employees on their benefits and also enable them to get partial unemployment. But unless they make less than the weekly benefit amount, and the maximum benefit amount in Tennessee is $275, they're not going to qualify for unemployment. And if they don't qualify for unemployment under state law, they're not going to get the additional $600 under federal law. So all that to say is you may be better with commissioned employees and some other employees to lay them off altogether so they get no wages, so they can receive both the state benefit and the federal benefit, which I know only lasts until July 31st. But at least for the time being, that might be a better course of action for those commissioned employees.
Next question, this is for Hugh, please. Hugh, this pertains to home-based businesses. You had indicated about the fire marshal and occupancy and how the percentage is determined. How does that, what guidance do you have for people who have home-based businesses?
This is a good question for what we were saying earlier, that we'll probably work through some of these things as we learn them. I think a home-based business, you would think by its nature, is not going to have as much foot traffic in it as a brick and mortar place somewhere. So I think we would just fall back on the, like we would any gathering at a home, 10 people or fewer, and face masks, and keep social distancing within the home.
Okay. Another question for you, Hugh. If an employee is unable to wear a face mask due to a medical condition and no alternative duties are available, or, excuse me, this may be for Martha actually. If an employee has a medical condition and cannot wear a face mask due to that medical condition, and there are not alternative duties available to for that employee, what do you recommend?
I think probably a reasonable accommodation in that case would be to keep the employee out of work. So if you can't come up with any sort of position that the employee could work in, which would keep them out of the, out of the public, or put them in an office by themselves, anything. If you can't come up with any other accommodation, I think keeping them home as the accommodation is fine. Of course, you don't have to pay them if they're home on a leave of absence, if you can't come up with telework, options for them. But clearly, if they have some sort of condition that could be a disability under the ADA, and you might have to accommodate it in that manner.
Thank you. Hugh, another for you. Any recommendations for recording studios?
Recording studios. I think the same thing. Now, I think I saw that question too, and maybe skipped over it. Recording studios would be, they'll have a capacity, but again, the nature of the business may be that social distancing may be a problem, but they need to try to maintain social distancing. And I think part of the question I saw a while ago had something about a big orchestra recording, and unfortunately, I think that may be one of the things that it's tough to do. I mean, so you've got people packed in together, and orchestras too. I mean, it could be aerosolized. Yeah, and recording studios are phase 2. Somebody's pointing to me, and I think so. So anyway, yeah, that's going to be a difficult one to maintain social distancing and get an orchestra in an area big enough to do recording in a studio. But if it's just a small group or an individual, then maintain social distancing during the recording sessions and keep the crowds down below 10.
Hugh, this is a follow-on to a comment you made early on. If we lease office space within a larger office building, is capacity based on the entire office building or just the space we lease?
It would, well, if you control, it'd be the space you control, but then you're going to have a capacity based on the whole building. Now, I assume, I don't know the fire marshal's law, but it may be like, it could be like the mall situation where the common areas have a certain amount of capacity, and then each individual room or business would have a capacity. But I don't know, that would be the individual office spaces would have their own capacity, and it would be based on the fire marshal's office.
Dr. Jahangir, for you. the roadmap for reopening states that during phase one, everyone should work from home if possible, but of course it also states that commercial businesses can open at reduced capacity. I should say certain, the question should say certain businesses can open at reduced capacity. Could you clarify the city's preference and recommendation?
So I think until we have a vaccine, our new normal will be as much as is possible for people to social distance and work at home within reason. Now, especially for our perhaps older employees and those with medical comorbidities. But the city's preference when you open is if you need your employees there, have them be there, but use the precautions we've referred to, and that's kind of just. But ideally, until we get a new normal, until we have a vaccine which allows us to get back to what we knew, try to take these precautions that we've referred to, and if somebody can stay home, maybe not 5 days a week, maybe they come in for a few days a week and then work remotely for a few days. Anything to minimize exposure is really a nice idea. Thank you.
Dr. Jehungir, could you also answer questions regarding retailers who are having difficulty locating face masks and gloves?
Sure. It is a challenge. I think as much as one could do cloth face masks, and it may have to be something you make yourself, that'd be the way to go. If there is a need for the unified command from the state, from the federal government received some shipments of masks, gloves, etc., that are medical grade that they've given to Office of Emergency Management here. Typically, though, that's reserved for first responders and health and other health systems. If you feel, however, that there may be a need for something of that caliber for you, the Office of Emergency Management is perhaps where you'd make that request, but understand that for the most part, short of it being for a medical reason, that's going to be harder to obtain through city and state's channels. So,
Dr. Jehungir, could you address, is testing available in Davidson County for people who do not live in Davidson County,
Sure.
employees?
That's a superb question. So I'm really proud that over the past month, we have, we as a city have tested about 5,000 people just last week. And our community assessment centers, which we've opened Monday, Wednesday, and Monday, Wednesday, and Fridays, tested 2,700 people last week. As we expand, we begin reopening, we recognize the need for small businesses and others who may have employees that show up that are screened at the door, who all of a sudden have a fever or symptoms, and we want you as small business owners to have a place that you could refer them to. So starting next week, 5 days a week, we will have our assessment centers open: Nissan Stadium, Meharry Medical College, and Kmart off of Murfreesboro Road in Antioch. While these are city resources that have been put in to open these, we also welcome anyone that needs to come get assessed and tested to come. We don't advertise the fact that we'll pretty much see anyone because these are for our residents typically, but they're also for our as a business owners, you are residents of our city, in my mind, and your employees are also residents, and we want to give them a resource, so they are welcome to come. Please allow them to come. It's free. We collect the bare minimum information needed to be able to get a hold of them, and thus far, we've been really fortunate. We haven't had lines, and it's been really quickly, and our turnaround time on results are within a few days.
Dr. Jehungir, could you address why is Davidson County taking a different approach from the state with respect to various businesses and enterprises?
Sure. So I think the governor correctly recognized early that the 6 major metropolitan areas have their own health department, and this goes historically why there's 6 of us that have their own health department. We're a different entity. Usually they're bigger, there's more density, there's more complexity than other parts of the state. And for those reasons, the governor essentially said, hey, for almost everything, you guys figure out your local levels, what makes sense for your community. And with the leadership of Dr. Caldwell, Mr. Atkins, and others, and the mayor, we've looked at these, and we believe that these are what makes sense for us. We want to open quickly. I assure you, meeting with the mayor as much as I now do, He wants to open up. He wants to get us all back to as close to what we were beforehand. But he also is sensitive to recognizing that he wants, public health experts and health policy stuff have shown, and you can find any model you want to find, and Vanderbilt actually had a study last week, that if you delay opening a week or two when you're in the upward trend, which we are, your long-term probability of staying open for longer is really much better. So a small investment on the front end leads to a much bigger return on investment at the long end. And the reason that matters is, while it has been crippling what we've been through, I think all of you probably agree with me that if we start, we ramp up, and then we have to shut everything back down again, that second hit or a second wave has even been shown to be more crippling. So I know it's hard. Mayor understands it's hard, but this is why we've approached it the way we have.
Thank you. Next question for Martha Boyd. If an employee gets COVID-19 once we open up again, can businesses be sued by that employee for medical expenses, et cetera?
Okay, so likely not. So your employees, I guess the worst case scenario is they claim it's work comp. They're unlikely to prevail on that kind of claim. To have a successful work comp claim, you've got to show that the business, you had a greater chance of contracting the disease because of something specific to the business. For example, if you work around silica dust and you get some sort of silica disease, that's obviously something that occurred as a result of arising out of in the course of your employment. Contracting a communicable disease, even if you contract it at work, probably isn't going to qualify you for workers' compensation if there's nothing about the place of business that gave you a better chance of getting it in the business than other places. Now, if you work in a clinic with COVID patients and you get COVID, you might have a work comp claim in that event. But in most businesses, you're not going to be able to pursue a work comp claim against your employer. And because work comp is the exclusive remedy for workplace injuries and illnesses, you're not going to be able to circumvent that process and sue for wrongful injury or death either. To escape the exclusive remedy provided by work comp, you would have to show that your employer had the actual intent to harm you, which is a very, very high standard. So, I think employers should do their very best to keep their employees safe. I think it assists with morale. It gives their employees confidence and makes them loyal to the business. But I don't think the motivation should necessarily be to avoid liability, because I don't think there's a lot of potential for liability because someone gets sick at work on employers.
Thank you. Hugh, this is for you. Quite a few questions about where do the people on the call find the information that we've been describing, the toolkit, the signage requirements, the list of COVID symptoms that have all been supplemented by the CDC in the last few days. Where do they find that?
Good. There's a lot of good information out there, and the best place probably to start is at the Metro COVID-19 website, including the toolkit you just mentioned, and information on signs and okay.
And this video.
Yeah, in this video, we're going to upload it there. And I did actually mean to mention there are lots of resources. Just go to fda.gov and cdc.gov. They have lots of guidelines for businesses, and also even within the state of Tennessee, tn.gov has real good guidelines on their website about the reopening. And then many of these businesses are regulated through the Tennessee Department of Commerce and Insurance, and we have leaned on them a bit for information. So you can find out which board regulates your business, and they may have best practices and information available there too. So just look out for that toolkit coming up immediately, almost after later today. But yeah, check these sites out, and then look at this video. Okay.
Another one for you, Hugh. I don't see any notes on Metro website regarding apartment community amenities. No details are listed for areas such as a business center, cyber cafe area, but the gym, this person says, is phase 4.
Okay, yeah, any specific amenities like a gym is going to open when in the apartment at the same time it would at a standalone gym. So if you've got a gym in an apartment complex, it needs to be closed to the appropriate phase. Same way with the swimming pool for phase 2, I think. The office center or something like that could open now with social distancing requirements and in trying to encourage as many people to work from home as they can. But the same, just because it's only limited to the community of the apartment or the condo, it still presents the same risks that a standalone or one open to public membership. So even though it's an apartment gym or an apartment pool or an apartment playground or something like that, it would be treated just like any other one of those in that appropriate phase.
Martha Boyd, if all employees were furloughed at the same time, is there any legal requirement that those employees need to be re-engaged at the same time?
There's no legal requirement. I mean, you can bring those employees back in whatever manner you want, so long as that manner is a non-discriminatory manner. So you don't want to select the employees to return based on race or sex or disability or anything like that. So, what I recommend is that you talk to your employees. You will likely have some that are gunning to get back. You will likely have some that are perfectly happy to remain at home, particularly if they are drawing unemployment. And so I would sort of base it initially, if you can, on employee preference, and certainly not on any discriminatory factor. I wanted to follow up on the question you asked earlier about employer liability for employees who get sick at work. I spoke about work comp. Another issue I wanted to raise is employers have a general duty under the Occupational Safety and Health Act to keep their workplace safe, to avoid known hazards and things like that. So I think employers need to be cognizant that they are obligated to retain a safe workplace. Again, I think the opportunity for liability lawsuit by an employee is low, but certainly an employer has an obligation separate from the potential for liability in a lawsuit to keep the workplace safe. So I just wanted to add that point.
Alex, this is for you. When will we determine the different phases of reopening when we go specifically to phase 1? I know you touched on it at the beginning, but people have some questions about that. And then phase 2, and how would people know what phase we're in at any given time?
Sure. So first, I encourage everyone to go to covid19.nashville.gov. Right now, we have our link to our metrics. So you have we have the 5 or 6 things we're looking at, color-coded, red, green, yellow, to know where we are. And then it links to where more detailed information. So every day you can track where we are as a city on the metrics we're looking at. Our hope is maybe we'll announce early as next week if we're going to go into phase 1. We are going to give about a 3 to 4 day lead time. So you don't say, hey, we're going to phase 1, and then an hour later we expect everyone to be open and you compete. So please know there will be a little bit of a lead time. And then once we move to phase 1, then assuming nothing really regresses, and what makes it regress is, let's say we have a horrendous increase in cases, or hospitals are at capacity, and I mean, some bad stuff has to happen to regress. But assuming that it doesn't, and we're continue to show positive things based on our metrics that you will have access to at covid19.nashville.gov, we'll then move to phase 2, 3, and 4 just like that. So we've always committed to transparency. We want everyone to know where we are, and this information sessions also is very helpful to at least give you that, I hope.
Alex, another question for you. Just to clarify, cloth face masks are considered acceptable for employees.
Yes.
This is for Martha. Are you aware of any HIPAA requirements or liability in asking employees health questions? You touched on this a bit earlier, Martha.
Yeah, no, I mean, typically an employer, a business asking questions like the ones we're talking about, the screening questions, would not be a covered entity under HIPAA. And so would not have to consider the information, protected health information. That said, it still is confidential. The Americans with Disabilities Act imposes requirements on employers to keep employee health information confidential under the ADA. So information should be kept about employee health conditions should be kept in a file separate from the employee's personnel file. It should be locked up, and it should be provided only to individuals in the business with a need to know, like managers, the supervisor, things like that.
Dr. Caldwell, a final question, and then we'll let you wrap up. Is it a minimum of 14 days before moving to the next phase? For example, if we open phase 1 on May 8th, are we looking at May 22nd to go to phase 2 if everything is still looking good?
If everything's still looking good, yes, but we're not bound by those things. That would be determined by the data once again.
Thank you.
Well, that brings us to the end of this webinar now. We appreciate all the questions that you've asked. We've tried to answer as many of them in as real time as possible, and we will catalog those. Thanks to all who have viewed and participated in this. Thanks to Mayor Cooper and Mary Falls in the Mayor's office. Thanks to our participants, Dr. Alex Jahangir, Mr. Hugh Atkins from the Environmental Division of the Metro Department of Public Health. Thanks to Martha Boyd from Baker Donaldson. And thanks to those peer advisors that came to talk to us, Manuel Delgado from Delgado Guitars, as well as Mark Faulkner from Vario Systems. I think this has been a great, just beginning conversation for us to help us be sharing, to educate, to communicate, that we are all leaders together, that we're going to continue to identify and implement best practices. The technical advisory support team on reopening that we will be providing you more information on will be in addition to all the other resources that will be out there and available to you. I'm going to suggest that every single one of you and your colleagues write down a written plan on your plan for reopening. This will help you think, to be creative, to share with your employees and get input from your employees and maybe even your customers. Find out what's important to them so that you can put that in your written plan. That written plan will have some examples of other written plans that you can look at to try to get some ideas. And if you have some and you like a written plan you'd like to share, please let us know that. We're going to ask you to submit that written plan when you have it to the Department of Health at some point. Now, it's not going to be submitted to us for approval. It will be submitted to us as your commitment that you have a written plan, that you've put it together, and will serve as a resource for us to learn. We will be there as well. The plan will be there. In case we were to get a complaint about something going on at the particular business, we'll take that written plan as a beginning to say, okay, are you actually enforcing your plan? Because you don't want to just have a plan that you're not enforcing. And I know it's not just up to the business owner to enforce it, it's all of your employees as well as all those who visit you to enforce. So thank you for joining us today. We continue to learn and to share information with you as we learn it. Please go to covid19.nashville.gov and that this webinar will be available. So let other people know who couldn't be here to view it, and we'll continue these conversations. Have a great rest of your day. Thank you.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.